So for Elsie, she has Alzheimer's, so we need to understand if she still has the capacity for making decisions around her healthcare, both now and for her future. And it may be that we might have missed the boat, as an advanced care plan can only be made if the patient has capacity. For Elsie, I think she has strong views about where she would like to be cared for. And I think for her, the advantage would be to disseminate that information and to proactively plan to keep her in her preferred place of care and her preferred place of death. It helps the healthcare professionals as well as helping the patient. So you will know what's important to your patient by obtaining an advanced care plan. You can support them in their decisions on appropriate care. So patients don't always obviously understand what the options are with care. Many people actually these days believe that you do have to go into a hospital if you're dying. That is where people die. So by exploring these issues in advance, you can help them decide on what is appropriate for them. And it can help prevent crisis situations, so that if you know what patients want, you've planned proactively for that situation, then you are more likely to keep that person out of the crisis situation, out of the hospital accidents and emergencies. The only perceived disadvantage would be maybe her distress at talking about the subject. But in fact, the Dying Matters Coalition did a study whereby they looked and surveyed people who'd made advanced care plans, and their conclusions were that 9 out of 10 people actually appreciate the chance to talk about their future care planning. And they either continue the conversation when it's first raised by the healthcare professional, or they will come back and talk about it later once they've raised the issue. So I don't think there are really any disadvantages, bearing in mind that an advanced care plan can be changed. It's not something that's written in stone.